Schizophrenia is severe mental disorder which is full of mystery since ancient time. It affects around 0.5% of world population and affects equally to male and females, but in males it's much more severe. Usually schizophrenia is diagnosed between 16 to 30 ages, so usually it affects young people, and in males it occurs more younger age compared to females. Now let's say what is schizophrenia itself, what symptoms it has. We can image like this. First person is healthy. He or she has healthy childhood, and you can't differentiate him or her from other healthy individuals, but such people who carry some risk of schizophrenia can have some symptoms such as social withdrawal, irritable and aggressiveness, and cognitive problems at childhood. But based on these symptoms you can't make any diagnosis or any predictions, because most children with such symptoms are normal and healthy in adulthood also. After healthy childhood, persons have early symptoms. Early symptoms, also called prodromal period, it lasts around 1 to 2 years, and this prodromal period is already noticeable. It's characterized by social withdrawal, tension, and inappropriate behavior, such people losing contact with friends, sometimes family members, and their lack of social activity, or their grades are lower in school or university. And after this prodromal period, acute psychosis or acute phase of schizophrenia starts. And what is the most important and most common symptoms? We categorize acute phase symptoms into 3 categories, which are called positive symptoms, negative symptoms, and cognitive symptoms. Now I will explain what it means and what these symptoms are exactly. Positive symptoms means when symptoms are additional behaviors not seen in healthy individuals. So generally we have some behaviors, and this is normal line. And in case of schizophrenia, people have additional symptoms, additional to normal. Another type of symptoms is negative symptoms. Negative symptoms means decrease in normal behavior, emotions, or interest. So such person is lack of interest. So normal interest line is here, for example, and such person has lower interest, lower emotions, lower behavior. For example, he is very passive, lack of emotions, lack of interest, for example, social activity. And cognitive symptoms. Cognitive symptoms means memory problem, for example, or disorganized speech. Such people frequently speaking very disorganized. You can't understand the idea well. They can switch from one topic to another topic. They can split their topics, their words, and such things. So it's disorganized speech, and they have more memory problem. And maybe he's saying or she's saying one thing one moment, and after 5 minutes he don't remember what he said. So they have memory problem, not only short term but long term memory problems also, and it's cognitive problem. So they have positive symptoms, negative symptoms, and cognitive problems. Now let's say what is positive symptoms, and let's say what is most common type of schizophrenia. Most common type is paranoid schizophrenia, and what it means. It accounts around 40% of cases of schizophrenia. And what means paranoid? Paranoid means when person constantly afraid that he or she is persecuted. For example, person says, neighbors are trying to poison me, trying to kill me. They think that they are being followed by a cult or group of people and they want to hurt them. And this is delusions. These symptoms are delusions. So such people believe what is not true. That's delusions. And second type is they hear voices. It's hallucination, auditory hallucinations. They hear voices, for example, and this voice telling to them that, for example, harm himself or harm other. Go and kill your neighbor. Go and kill your family members, for example. This is hallucinations. So that's paranoid schizophrenia. So paranoid schizophrenia have two most important symptoms. That's delusions of persecution and auditory hallucinations. And they are positive symptoms. They are positive symptoms because normally a healthy person don't think such thing, don't have such beliefs, don't hear voices. Of course, person hear normal voices from environment, but not hallucinations. That's why it's positive symptoms. Negative symptoms, we already said, it's when person is passive, lack of interest, lack of social activity. It's passive. And what is thought? What is main cause of schizophrenia? Main cause is dopamine and glutamate activity in the brain. Dopamine and glutamate, both of them are neurotransmitters, and when dopamine is high and glutamate is low, we have schizophrenia symptoms. Especially if dopamine is high, we have positive symptoms. We have delusions. We have hallucinations if dopamine is high. If glutamate is low activity, we have passive symptoms or negative symptoms such as social withdrawal, such as passiveness of person. That's negative symptoms, lack of emotions. And what is mainstay treatment? Treatment is antipsychotics, is medications. We have two main generation of antipsychotics, first generation and second generation, and most common medication used in case of schizophrenia is Aripiprazole. It's second generation medication, and it's considered safest among antipsychotics. And now let's say what is prognosis, what happens after many years. We already know we have childhood period, we have early symptoms, which is called prodromal period, we have acute psychosis, or we have acute schizophrenia, and then we have residual phase. Residual phase lasts whole life after acute phase, and the residual phase anytime can revert into acute psychosis, acute symptoms, then residual phase again, then acute symptoms again, and etc. This alteration is common. And what is prognosis again? Prognosis, we can remember like this: in 30% of cases, prognosis is good. So in 30% of cases, such people can manage their life themselves. They can continue working and social activity and independent life. That's 30% of patients. Another 30% of patients have moderate symptoms. They still have some improvements and symptoms already weak, but symptoms still continue to exist. That's another 30%. And another 30% is severe. Only small portion of time there is residual pain, and they most of time have acute psychosis. That's another 30% of cases. And now let's answer the question if such people should live among us or live in hospitals or special care territories. Independent schizophrenia severity. For example, this 30% lives among us very well and no any problem, not any threat for themselves or for others. But this 30% who has severe symptoms, and especially if such people are aggressive, sometimes it's important to isolate them from other people. So such cases, isolation is needed. So it depends. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.